Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. I'm Chris Holman, and of course, we're in our studios in downtown Lansing, which is not where we are all the time, but we have a rule in here, one person per floor in the studios, and that's what we're abiding by right now. We are very fortunate, however, to be able to reach out and grab expertise from the community, and we're fortunate again today to have Peter Graham, Doctor, Chief Medical Director at Sparrow PHP here in East Lansing. And Doctor, welcome to the show, and thank you so much for taking some time.
Thank you, Chris. Happy to be here.
Well, I got to feel that your time is at a premium right now. That COVID-19 has made a resurgence, of course, in our community and throughout the state. Tell us a little bit about the current status of COVID in our state, and of course, in the mid-Michigan or greater Lansing region.
Yeah, made a resurgence globally, nationally, as well as in Michigan. I think the most important thing for listeners to know is how widespread this particular outbreak of COVID is. It's either second wave or third wave, depending on whose math you use, or continuation of first wave. Whether we really got out of it or not isn't clear. Seeing pretty high positivity rates all throughout the state, and qualitatively, what's different this time, as before we. Back in the spring, we had a pretty concentrated outbreak in Southeast Michigan and a little bit in the outstate area. This time around, it's the entire state. And we're seeing it pretty much, Lake Huron to Lake Michigan and Ohio border clear up to the Upper Peninsula. So there really is no place that's kind of quote unquote safe. Unfortunately, that's also resulted in an awful lot of hospitalizations. We really started to kind of see peak cases. Most of the hospitals in Michigan, if not at full capacity, are getting very, very close. The other really worrisome thing at this point is that we're starting to see a lot of caregivers, particularly nurses, respiratory therapists, begin to get ill as well. That decreases the capacity hospitals have. Most of the time when you're talking about hospital capacity, you're really talking about nursing. And if a lot of their nurses are sick or unable to work, then their ability to take care of other people is jeopardized. So pretty serious situation at the moment.
Well, it's interesting because we talk a lot about the devastation of COVID-19 and the havoc it's playing on the population. We forget that the people who are facilitating recovery are the ones under siege right now. That's probably our biggest concern, I would think, is it not?
Very high up there, and how to keep the caregiver safe, and that's really the reason we're asking, along with the Michigan Department of Community Health and CDC and others, we're asking people to take measures on their own to stay safe, is partly to protect each other. It's to protect frontline healthcare workers because, they are vulnerable. The other issue is that when their capacity gets overtaxed, we're not able to take care of other things. So, if people get in a car accident or have a heart attack or the other things that you just can't predict or plan on, the resources we normally count on to be there won't be there if those people are sick.
A lot has been talked about the demographic of who it's attacking. Older people are more vulnerable, et cetera, et cetera. Talk a little bit about that for a few seconds.
Yeah, it depends on whether you're talking about risk of complications or death from COVID, or whether you're talking about spread. And what's interesting right now is the age group that is most vulnerable, so we've known this since the spring, are people really 60 and up, to some degree 50 and up. Although I'd stress that people any age can get very, very sick from this. We've seen teenagers, early young adults get deathly ill, and some expire, even people without pre-existing conditions. The group that's doing the most spread right now is 20 to 24-year-olds, college age kids and slightly up. So partly because they don't get as sick. And if you think about what kids that age tend to want to do, and I don't blame them, it's, they want to be with their friends. They want to socialize. It's very important to them. But they're the population that is spreading it the fastest.
So let's give about 30 seconds here to Thanksgiving. We've got it coming up, and that's a natural for bringing groups together.
Yeah, and the one thing I'd really urge people to do, I would love to be sitting around a Thanksgiving table arguing football and politics with my extended family and out to the nth cousins. We're not doing it this year. My wife and my two sons who live with us, we're just going to be the four of us. And I'd ask people to consider doing the same. It's just a recipe for an awful lot of spread. And then 4 weeks after that, we have Christmas. If you get those two things stacked on top of each other, it's like a tsunami on a tsunami.
Yeah. Well, you're fortunate in that if we talk politics at our Thanksgiving table, it ends in a food fight. So that's good. Hey, let's talk about the importance of this time of year for a lot of people, and that is that they're making some real decisions on their healthcare plan.
Absolutely. I appreciate that. Really quickly, we have annual enrollment for both of our individual plans and for our Medicare Advantage plans. They extend through Medicare Advantage through December 7th, annual enrollment for individual plans through December 15th. Really a good time to make sure you keep your healthcare coverage. Last thing you want to worry about right now. If you're at all interested, phpmichigan.com, great place to go to, size up plans, figure out what really works best for you.
Absolutely. Dr. Peter Graham, Chief Medical Director at Sparrow PHP East Lansing, thanks so much for joining us, the update, and have a great Thanksgiving and Christmas.
Thank you too, Chris. Stay safe.
All right. We'll be right back on the Michigan Business Beat. I'm Chris Holman on the Michigan Business Network.